Hi, welcome to this session. In this, we are going to cover the hemorrhagic stroke. What exactly is hemorrhagic stroke and what does it result in and what could be the issues to deal with? Let's gain a perspective. The hemorrhagic stroke, in short stroke, results from the weakened vessels which is on the blood vessels and the ruptures and the bleeds into the surrounding area of the brain. The blood accumulates and compresses the surrounding brain tissues. So this is at the stroke impact what is happening. In general, there are two types of hemorrhagic strokes. One, there's subarachnoid hemorrhage, and two, intracerebral hemorrhage. Let's understand each one of them briefly. The subarachnoid hemorrhage, SAH as often abbreviated, occurs when the blood vessels bleed into the tissue deep within the brain and the skull. The intracerebral hemorrhage, ICH, occurs when the blood vessels bleed into the tissue within the brain. As you can see, the arteries that penetrate the brain tissues can rupture and cause the intracerebral bleeding. And the cerebral artery aneurysms can cause the subarachnoid bleeding. The ICH, as we have seen, it occurs between the tissues within the brain, and there are two other leading causes that would essentially increase the risk. The high blood pressure and the trauma are the two leading causes for this. Taking blood thinners, rather the blood thinning drugs, also increases the individual's risk. The ICH essentially is caused by the bleeding in the brain tissue itself, and this is a life-threatening type of stroke. And the stroke, as it occurs in the brain, is deprived of the oxygen and the blood supply, and this would create serious medical conditions, including death events. So it needs the right attention by from the specialist. The ICH is most commonly caused by hypertension, the atriovenous malformations, or from head trauma. So, user as a time or the consumer who is going through such situation could correlate and understand from which situation they are coming so as to correlate. For example, the hypertension. The treatment essentially focuses on stopping the bleeding and removing the blood clots, this hematoma, and relieving the pressure on the brain. So these are naturally done by the specialist so as to uh, restore the normalcy or get them towards the normalcy, which is typically a long drawn process after a stroke. Let's understand some of the terminologies and some of the key terms associated here. Dura, as you have seen in the layers, this is often called dura mater or dura in short, and is one of the key layers of the connectivity tissue that make up the meninges of the brain. And basically it includes, the first is the pia mater, then you have the arachnoid, then dura, and this is the layering from the inside to the outside, as you can see in the picture. The outermost layer of the three meninges that surround and protect the brain and the spinal cord. So this is an important aspect to just be aware of. Also, the three types of meninges that surround the brain and the spinal cord, the makeup of the fibroblasts and a large amount of the extracellular collagen as well. The dura mater is composed of two layers. One is the periosteal or endosteal layer, and you have the meningeal layer. The dural venous sinuses are between these two layers. The dura folds to form the septa that create the phallus cerebri, tentorium cerebri, the phallus cerebri, and the diaphragm cellae. As you can see on the arachnoid, the picture here shows you the different layers right from the skin to the postloceum to cranium and then dura mater to the arachnoid mater and the innermost, the pia mater. The arachnoid matter is the middle layer of the meninges directly lying within the dura mater right underneath that, and it consists of mainly the connectivity tissue and is avascular and does not receive any innervation. And underneath the anechoid is the space what is referred as a subarachnoid space, and it contains the cerebrospinal fluid which acts to cushion the brain. Small projections of arachnoid matter into the dura, often known as arachnoid granulations, allow the CSF to enter the circulation via the venous sinuses. The subarachnoid hemorrhage (SAH) is the medical emergency situation and occurs with the bleeding in the space between the brain and the surrounding membrane, which is the subarachnoid space, and it is filled with the cerebral final fluid CSF, which acts as a floating cushion to protect the brain. And this condition of SAH results from the bulging of the blood vessels that burst in the brain. It's basically the aneurysm condition, and this will lead to permanent brain damage or death if not treated promptly. So immediate medical attention is the norm so as to potentially save any person. The main system is a sudden severe headache that is manifested earlier, and then the other consequence items follow through. The hospital care is immediately needed, and the supportive care to stop the bleeding and limiting of the brain damage is very essential. So a timely intervention as fast as possible is basically the needed next steps. And the treatment would potentially include surgery or the catheter based surgery based on the medical conditions. Skull, as you know, is the essential skeletal framework and is composed of the bones or the cartilage, which form a unit that protects the brain from and the other sense organs in that. And typically, the human skull is bony structure and forms the head in this human skeleton, and it supports the structure of the face and forms a cavity for the brain, and the skull basically protects the brain from any injuries. The cerebral artery aneurysm is basically also referred as intercranial aneurysm or brain aneurysm, is essentially the bulging and the weakened areas in the wall of the arteries in the brain, and this results in the abnormal widening or ballooning or bleb as it's referred. Because of these weakened spots in the aneurysm wall, there is a risk of capture wherein the bursting of the artery, for example, could result in a very adverse medical condition. The cerebral aneurysm frequently occurs in the artery located in the front part of the brain that supplies the oxygen rich blood to the brain tissue. And the arteries anywhere in the brain can develop this condition of aneurysms. The most common type of the cerebral aneurysm is called the saccular or berry or aneurysm in short, and its occurrence is almost 90% of the cerebral aneurysms. So this gives you a perspective. In addition, there are two types of the cerebral aneurysms that are fusiform and the dissecting aneurysms. A fusiform aneurysm is often associated with the atherosclerosis, which is more driven through the condition of the plaque getting deposited into the artery walls over time. Aneurysm rupture is basically the balloon-like bulge in the artery walls as we have seen through, and the aneurysm grows and it puts pressure on the nearby structures as well, and eventually rupture over time. And it's hardly unpredictable to have this, so that's why periodic review of each individual cases are needed. And the more proactive, that would be better to prevent any potential stroke. Uh, Continuing, the ruptured aneurysm releases the blood into the subarachnoid space around the brain, and this subarachnoid hemorrhage is life-threatening type of stroke and needs immediate medical attention. What causes an aneurysm to bleed? Though exactly the specific causes have not been analyzed, but what are the attributing factors that increase the chance of bleeding are measured. For example, first one would be the high blood pressure, and strong emotions and blood thinners are also the other contributors. Let's understand high blood pressure, which is the leading cause of the subarachnoid hemorrhage SAH. Heavy lifting or straining can cause pressure to rise in the brain and may lead to the aneurysm rupture. The strong emotions, getting upset or getting very angry and in outrageous mode, can raise the blood pressure and can subsequently cause aneurysm to rupture. Blood thinners, for example, warfarin, some other medications and prescription drugs, which including the dietary pills that act as stimulants. This includes the ephedrine and amphetamines, and the harmful drugs like cocaine can cause aneurysms to rupture and bleed. So identifying the other associated causes also is important for the medical experts to give the right type of intervention. The contextuality has to be factored in as well. Medical therapy. So what essentially goes out when the aneurysm condition is there? So how to go about and treat? So there are different options that are available. The medical therapy to neurosurgery to neurointervention is and essentially done by the interventionalist as well as the neuroradiologist. The entire team is needed there. Let's understand on the medical therapy. So when the unruptured aneurysms are there, then essentially the triggering of the symptoms or the rupture is likely to happen, and so that's why periodical checkups or at least the annual checkups to monitor the blood pressure, the cholesterol in the body and other vital medical conditions, so as to preempt that and make it as part of the therapy and avoid the ruptures to happen. And the neurosurgery, depending on the person's risk factor, open surgery may be recommended. And patients that are placed under the general anesthesia and the neurosurgeon places a surgical clip around the base of the aneurysm to avoid, or rather, it's the medical treatment option for the aneurysm situation. The neurointerventionologist and neuroradiologist, depending on the aneurysm size, location, and shape, they will be able to treat the inside of the blood vessels. And this minimally invasive procedure and that is similar to that of the cerebral angiogram, but with additional steps that are needed to seal off such a, what do you say, rupture. So this gives you a perspective on what's a hemorrhagic stroke and how to deal with and gain a perspective into this type of stroke. And for further information, you can get out to the website and download any potential information. Thank you very much for your attention and look forward to see you again. Thank you.